keep them healthy, but without legally paying any FBT, or how to keep the dreaded FBT man at bay. First up, and this applies to all benefits that fall within the FBT remit, don't. As in, don't package the benefit. Whether it's health, life insurance, or car, don't package it in their compensation. Aussies don't expect it, despite the fact that if you're over 31 here in Australia without private health insurance, they have to pay another lifetime health cover loading. And if they're earning more than 93K, they've got to pay another personal tax, the medical levy surcharge, which gets up to about 1.5%. So if you can, leave it off the table. And certainly don't start with it for Australian employees. However, as we've discussed in our health insurance forget about it FAQ short, for some employees you can't avoid it, especially health insurance. Less so for life and other insurances, but there are two exceptions, and they typically are sponsored visa employees, 482s and the like, and lifer Aussie expats, those who've spent most of their life working abroad. Now, if you want to know more about why those two exceptions exist, I refer you to the previously mentioned FAQ short, Health Insurance Forget About It. This FAQ is intended to tell you how you can legally avoid the whole FBT schmozzle and legally fulfill all of your obligations, statutory, financial, to the taxman and the government, without going down the FBT rabbit hole. And I can assure you, it is Alice in Wonderland down there. First, get to understand the personal expectations of both of these groups in terms of their approach and their needs and wants. It could be that some benefits can be excised without any further discussion and without further pain and still leave a happy employer-employee relationship. Second, assess the actual annual costs on an employee-by-employee basis. And then, differentiate. For the sponsored visa employees, these individuals are required, as part of their visa, which you have presumably sponsored, to have private health insurance. Who pays for it is not specified by law. You are just required to have it in place. So offer your employees an additional separate band of fully taxable income that, when grossed up and taxed, results in a net income for the individual capable of covering fully the costs of the benefit that they contract personally. Key that they contract it personally and you do not pay it directly. And for the lifer Aussie expats who've lived their life around the world from Hong Kong to San Francisco to New York, though their worldly travels for work and presumably now more senior position in the organization may induce an expectation of fringe benefits or perks, they're not required to have health insurance in this country once resident back down under. They may well be aware that they will personally have to cover or cope with the lifetime health cover surcharge and the medical levy surcharge, presumably at the top 1.5% if they are that senior and well paid. But they'll also be savvy enough to listen and recognize a tax impost when they see one. Offer them the same offer you would offer your sponsored visas. Pay additional guarantee bonuses on top of their negotiated base, which when grossed up delivers a net income fully after tax that pays for whatever benefits you may have agreed, inadvertently or consciously. For both groups, review annually. Keep it separate, leaving the bonuses line separate from the base. That gives you more control of your annual renegotiation of their salary. Rinse, repeat. Now, if you can't achieve the solution for the latter group, the lifers, due to their intransigence, their intelligence deficit, it does happen, or income insecurity, then reluctantly give up and pay the FBT VIG. Especially for the latter group, they're probably already in the top marginal tax rate here in Australia, 47% including the Medicare levy, not to be confused with the medical surcharge levy, which is the same as you, the employer, would end up being required to fork out an FBT. So this isn't the case for your more junior employees, i.e. those who are earning currently under 180K per annum, because they will pay less tax under our method but achieve the same benefits legally than you, and the employer would be required to pay for the FBT, which is always taxed at the top marginal rate for the country, regardless of what the top marginal rate is for the employee. We never said it was going to be simple. Contact us if you'd like some further clarity. This is J Warrick, your comprador in Sydney, Australia.